Hi everybody, my name is Ursula Philpot. I'm a registered dietitian and I'm presenting a series of videos around how you can change diet and food habits to help you manage persistent pain better. And so Mediterranean style eating, we know from research, can really help people with persistent pain and it can help with low mood as well. So it's one of the ways of eating that we're really encouraging people to think about. And it might sound quite far removed from the way that you eat at the moment when you're thinking of those countries in Italy and France and Greece. But actually, it's about trying to identify some of the things you probably do already and thinking about small changes you can make to add in some things from the Mediterranean style eating. So I'm going to talk you through that a little bit more. So we know that from the research that patients following a Mediterranean style eating plan for around 6 weeks reported to have less pain. We know that people following a Mediterranean style eating plan for 12 weeks reported to have improved mood. So we really think that these are kind of helpful ideas for people who have persistent pain and maybe have mood disorders with that. I'm going to talk you through what Mediterranean diet looks like because it's quite a broad term. But in kind of essence, it's about reducing some things in your diet and increasing other things in the diet. And for me, it's really important that we start with increasing things in your diet. Let's not just take everything out that you enjoy. Let's think about what you can add into that diet to make a difference. So one of the cornerstones of Mediterranean eating is what we call whole grains. So things like brown or whole grain rice, pasta, bread, oats and other grains. And so if you tend to have the white versions of those at the moment, one of the changes possibly to make is to think about moving to those whole grain or brown varieties. You don't have to do it all at once. You could start with rice or you could start with a cereal, for example, and just do those slowly. Bringing in more fruits and vegetables. So in the Mediterranean, we tend to think of a kind of rainbow of fruits and vegetables across the day. So adding things like more kind of green leafy vegetables, things like broccoli, spinach, lettuce, cabbage, those kind of things. We also think about having more tomato-based sauces. So tomato-based sauces are made with either tomato passatas or canned tomatoes, those type of things. They often have onions and garlic in them as well. So having those at least twice a week is, again, an essential part of Mediterranean-style cooking. Adding in fruits, again, varieties of fruits from berries, tomatoes, the fruits, you can have them frozen, you can have them tinned. They don't necessarily need to be fresh. Adding nuts in as well, if you can have nuts, they're a great source to add into your diet. Just a handful every day, you don't need a lot of them. And any type of nuts can be positive and a useful addition. Using chickpeas, lentils, beans, peas and pulses more often. So one of the things we ask you to do is perhaps eat less meat in Mediterranean style eating and partially replace that meat with things like chickpeas or dals or lentils. The last thing is to have fish more often, particularly a type of fish called oily fish. So oily fish are things that have a kind of oily texture to it. So things like herrings, pilchards, mackerel and salmon, the cheap kind of canned fish that don't cost very much, or kind of fresher fish like kind of salmon or even fresh tuna. But any type of fish across the week is kind of useful and helpful for Mediterranean style eating. Other things you could think about adding into your diet might be seafood. Again, you can buy those frozen and they don't have to be fresh. And olive oil. So olive oil is really, again, a really important factor in Mediterranean style eating. So 4 tablespoons a day is what we aim for olive oil, which might seem a lot for people in the UK. But if you live in the Mediterranean, pouring olive oil onto kind of salads and vegetables and using it liberally in cooking is really important. So getting those 4 tablespoons across the day is an essential component of Mediterranean eating. Things like eggs and poultry, so things like chicken or turkey, we say have moderate amounts. So you can still have those every day. A couple of eggs a day or a portion of chicken a day is absolutely fine. And last, adding in things like fermentable products, particularly things like yogurt, for example, or fermentable onions or cabbage, things like kimchi or sauerkraut. Although they're not essential to Mediterranean style eating, they're really good for gut health and link well with kind of fresh rainbow of colours, fruits and vegetables that we would find in Mediterranean style eating. So one tool that we find really useful to help people to kind of remember and check in with dietary changes is something called the Mediterranean style checklist. So somebody within the Rethinking Pain team and one of the health coaches can help you with that list. Particularly if you're not concentrating very well, or maybe you're a little bit forgetful, it's a really helpful tool to help you to kind of tick off whether you've had the right amounts of foods and the right types of foods over the week. And you can tick off the things that you're doing already, which is great. And then you can have a look at the things that maybe you want to add more of into the diet. So things that you can add into your diet to make it more Mediterranean in style. The first thing we're thinking about is adding in a little bit more of the beans, peas, pulses and lentils. So those are things like chickpeas, black beans, red kidney beans, dals, red lentils. You can buy those dried, or you can have them in cans, which is a really easy way of using them. And you can add them to things like soups, stews, salads, casseroles, curries, chilies. Often they're a really good substitute for meat as well. So if you don't want to cut out meat completely, for example, if you're making a chili, if you reduce the meat by half and increased half of the bulk with lentils or beans or pulses, that's a nice way of introducing some of those into your diet. Adding olive oil to the diet is really essential component of the Mediterranean style diet. And for people in Bradford, in the Yorkshire area, it's not necessarily something that we're very familiar with doing. And I think for most people, 4 tablespoons can seem a lot. But it's a really important part of that Mediterranean style eating plan. So ideally, we'd like you to swap your regular oils and your butters and your ghees that you might fry with, or you might make dishes with. We'd like you to swap that for olive oil. If you can't find olive oil, rapeseed oil is quite a good fallback, and it's actually produced in the kind of Yorkshire region as well, so it's probably a little bit more available sometimes. With 4 tablespoons of olive oil, we ask you to perhaps weigh or measure that out the first couple of times you've used it, because it seems like that could be quite a lot across the day. One good tip is to add it to salads, add it to vegetables, use it in things like mashed potato, or cook with it. If you're frying something, if you're stir frying something, use olive oil in that cooking. So don't be scared of using 4 tablespoons a day. I often get asked, is this going to make me gain lots of weight? And the answer is generally no, not if you're eating a Mediterranean style eating plan and you're including olive oil as part of that. It's a part of a healthy change that you can make. So adding more fish to your diet when you're trying to change towards a Mediterranean style eating plan is really helpful, and it's a really nice substitute maybe to think about reducing meat products in your diet and increasing fish if you like it. So types of fish that you can eat are things like cod, pilchards, coley, panga, bassa, pollock. And then we'll move on to thinking a little bit more about oily fish. So oily fish are a particular type of fish that's kind of got an oily texture. And they produce a type of fats called omega-3 that are really important for reducing inflammation in the body. They seem to have a really good anti-inflammatory effect. So oily fish might be things like pilchards, mackerel, salmon, sardines, anchovies. So those tinned versions are absolutely fine. You can also get fresh versions as well, but tinned are cheap and readily available. So those are probably the ones to go for. We'd say with oily fish to try and have it at least twice a week, preferably up to 4 times a week if you like it. So for vegetarians and vegans, or people that just don't like fish in general, you can get the omega-3 fish oil from a different source. So you can take capsules. So particularly for vegetarians and vegans, there is a capsule that's made from algae. So usually the fish eat the algae and we eat the fish, but you can cut the fish out altogether and you can just go for the algae-based omega-3 supplements if that works for you. One of the things that you can do that's quite quick and easy for a Mediterranean style eating pattern and an anti-inflammatory eating pattern is to add in things like herbs and spices. So again, if you're trying to reduce your salt, herbs and spices are a really good alternative because they keep the food tasty but without the salt. So spices that you may already use in things like curries or kind of stews or chilies would be things like turmeric or ginger. So adding turmeric or ginger into the diet, if you use those already, having those more often or they're quite quick and easy additions. So again, ginger doesn't have to be fresh. You can get ginger paste that you can keep in the fridge and just squeeze that out of the tube when you're adding it into things. But they seem to have a really anti-inflammatory effect, and that's something that's quite quick and easy to add in. So thank you for listening to the video today. This is one of a series of videos that you can access from the Rethinking Pain website or the Rethinking Pain YouTube channel. In addition to that, we also have a diet therapy workshop that runs, and you can see a member of the Rethinking Pain team if you would like to access that workshop. And the more people we get, the better. So please come along.